Hi everyone, I'm Dr. Madhumita and you know me as MedicoMadhu. A lot of you have asked me for tips related to common things that we face, what first aid you can do. Well, I have collected, whatever I could remember, a few of them for which I'm going to give you inputs on first aid things that you can do. Well, if you have any other queries related to first aid, please comment so that I can revert back to you on it. Commonly, if you see someone unconscious, what can you do? First, go near that person, try to wake him or her up, and ask them to talk to you. If you realize that they are still not responding, just check their carotids. If you do not know what exactly is the carotid, you can just place three fingers on their neck. If you can feel pulsation, immediately loosen the top two buttons of their shirt and make them tilt their face to one side if possible. If not, just don't move them at all. You can immediately call for emergency and you will have to start working as soon as possible. Clear the area in and around them. If they are in an environment where there is a lot of gas or there is fire around them, move them to a safe area first. After that, you will be asking people around you because there is going to be a crowd near you. So you just ask them to move slightly away and to aerate as much as possible. Now you will have to start acting. What will you do? First, see if there is anything inside their mouth. If it is possible, immediately clear it off. Then you start giving them chest compression so that their heart starts functioning. If you are not sure whether the pulse is there or not, in that case, you will be doing this. And then you will have to give them enough oxygenation as well. Let's say there is no oxygen facility around you, ambulance has not arrived. If you have a clean kerchief, you can just put it on their face and blow from your mouth to their mouth, or you can blow from your mouth to their nose. So how are you going to maintain a balance? You will give 30 chest compression. If you do not know exactly where you have to do, just center of the chest, start pressing as much as you can. Give 30 compressions, followed by you take in oxygen, take a deep breath, and then you exhale into their mouth so that they get adequate oxygenation. Give two such breaths till the emergency service arrives. This is a common scenario that we all see. Apart from this, what else can we see? We see people bleeding. The minute you see someone bleeding, you just tell them not to panic, make them sit. Try to put a direct pressure on the area where the blood is coming from. If you are worried about, and you should rightly be worried about getting any infection, especially if it is someone whom you do not know, but you being a kind-hearted person want to help them, then I would suggest that you use a commonly available clean cotton cloth. If nothing else, you press it directly at the site. Press as long as 5 to 10 minutes. In the meantime, the blood should clot. Tell them not to move around. Immediately take the patient to medical attention so that they can treat it. Other than this, we see people who have got a burn or a scald. So what is the difference between burn and scald? Well, burn is when you have a direct injury, dry fire touching you is burn. Let's say you are injured because of a hot water or a hot oil has poured on you. Then that is scald. In this case, immediately you will have to cool the affected area. Pour cold water on that area for about 15 minutes. Let the pain subside. If there is a bleb that is formed, do not break it. Do not apply any turmeric or any ointment on that area. Get medical attention at the earliest. Fractures are commonly seen. Any leg injury, arm injury, you're not sure whether it's a fracture or not. Irrespective, if you feel that it could be a fracture, make sure you're not moving that particular part of the body. Let's say it's a leg fracture, then make sure that both the joints at the top end and the bottom end are not moved. So you give a padded support. Make sure that the two joints are also at well padded, and you tie it so that the limb does not move. Get the medical attention at the earliest. Bee sting is another common thing. So when you see that there is a bee sting, take a forceps or a tweezer that we have at home, try to take off the sting. Give the patient immediately an anti-allergic commonly available cetirizine, or you can give them the common brand names that you know, like Cetirizine, Allegra, any of the anti-allergic you can give them, so they do not have a reaction. Take them to the doctor at the earliest. We have snake bite cases. So you first try to identify what snake it is. Make sure that the venom does not spread to the heart. Let's say they have a bite in the leg. Immediately, wherever was the site of bite, on top of it, leave about maybe a hand space. With 4 fingers, you just give the space. You tie it tight so that the venom does not spread upwards. Kindly do not try to suck the venom with your mouth or to apply anything or cut that area. Immediately call for medical help. Let's say there is an animal bite. You're not sure what exactly you will have to do. All you have to do is immediately wash that area with soap and water and take them to the nearest medical facility that is available. If you really want to be very good with first aid, then there are facilities that are available. You can join one of these first aid services and you can learn from them. I have just mentioned few of the common ones. I will be updating you with many more first aids in the coming videos. Make sure you are living safely and you are helping others as well. But let's say there is a situation where you do not know how to act. Best is not to do anything, not to touch the patient at all, and to ask for medical help at the earliest. I hope this video was useful. I'll come back to you with many more interesting videos. Thank you.